Increasing access to mental health services and providing education and support to advance people's mental health and well-being in Minnesota is a mission for DFL Senator Judy Seeberger, who's here with me now. Senator, welcome to Senate Spotlight.
Thanks for having me.
Absolutely. So this session, you've supported bipartisan legislation that aims to fund things to help veterans and first responders work through the emotional trauma that they incur while they're, providing service to the community. And I know that's something you know about firsthand, being a first responder yourself and part of a military family. So talk to me about the need for services and legislation like this and what more you think can be done in that space.
As we know, we have significant needs for mental health services in the state of Minnesota and throughout the country. And it's been a mission of mine since I arrived here at the Senate to do everything that I can at the state level to ensure that we provide the services we need to for our fellow Minnesotans, that we adequately fund for services that are already in effect, and that we have new and creative ideas about how we can better reach folks in the community who need mental health services and maybe don't know where to turn or don't have the support that they really do deserve.
In committee, you said you know what it's like to raise a child with significant mental health issues, and so that's why you authored Senate File 2546, which appropriates money so youth who've been incarcerated can continue to receive the mental health services and supports that they need. So talk to me about what happens when these children and their communities don't get those services.
I think what we see a lot of times is youth who really should have some intensive mental health interventions wind up incarcerated instead. And when a young person is in the juvenile justice system and they have significant mental health needs, they should be able to get treatment and support for those mental health needs to ensure that the root of the problem is really addressed. If we can address those needs, and this funding provides needed funding for our correction services to be able to do that, if we can provide these youth with the services that they need, we can ensure that once the legal issues are resolved, hopefully they're on a path to healing and can be productive members of our society, which really is what we all want.
A bipartisan bill of yours, Senate File 2744, addresses the mental health needs in the construction industry, which was something I had been unaware of until I heard your bill. But according to the CDC, the construction industry's suicide rates are 3 times higher than the national average. Your bill was laid over to be included in the Labor Committee's omnibus bill, but it didn't make it into the final version. So are there any state or national, local programs that these workers can utilize now to still meet those needs?
I want to correct you in one thing. I do believe it made it into the Senate Labor Omnibus bill that we passed off the floor earlier this week. So I'm really proud of that work, or last week actually. I'm really proud of that work. And you're right, the construction industry has been overlooked, I think, when it comes to encouraging folks to step forward and raise their hand when they're not okay. We heard testimony in the Labor Committee that folks in the construction industry don't feel, there's still a stigma in the construction industry to be able to step forward and say you're struggling with their mental health. And we don't want that. We've addressed it in other areas. We had a huge initiative to help farmers to try to lower barriers to access mental health resources, to lessen the stigma of folks who are struggling with their mental health. And we want to do the same thing in the construction industry. So I'm really proud of my bill to be able to do that. And we have to keep talking about it, and we have to keep making it okay to step forward and say, look, I'm not doing so good right now. I'm going to avail myself of some of these services over here and really start having that open conversation.
And congratulations to the bill making it in. That's a great achievement for you and for that industry.
I think it's going to make a big difference.
Fantastic. For some of the bills that have been laid over, that means that they're supported and appreciated by your colleagues, but they don't make it into omnibus bills because it is such a tight budget year. Do you have hope that some of those bills can still be enacted because we're coming up into a policy or a bonding year, or do you think that they'll have to wait until the next biennium?
I'm certainly going to fight for them to be heard again. As you mentioned, we're in a budget year right now, and I think we have enough of a heavy lift to try to get a budget through this year. When we get a budget done, I'll be happy. If some of the policy provisions can also tag along with that, all the better. If we don't get it done, again, our first priority is getting the budget done this year, but this is a biennium, so our late great Senator Dietzick used to say that the interim between the two sessions in the biennium is a halftime. So when we come back next session, if things that are important didn't get included this session, we can just pick them back up and move them through the best we can next session.
I like that analogy. There's still half the game left.
That's right.
Earlier this year, you spoke about the need for an early or a standalone bonding bill for infrastructure projects. So where do we stand in that process now?
Again, everything remains at play. I've had ongoing and really good conversations with the Capital Investment Chair, Senator Pappas. She wants a bonding bill just as much as all of us do. I've got some important projects in my district. Probably the most important is the water treatment project in the city of Hastings, and I have her assurances that there is money in the bonding bill for that project. We just have to get it done. And as you know, in the final days of session, there's a lot going on, a lot at play. Again, the budget is the most important thing, but certainly since we didn't get a bonding bill done last year, it is critical that we get a bonding bill done this session as well.
And talk to me more about that water treatment plant for Hastings. I know that it was wanted to help filter out PFAS contamination. So, and also being someone in the fire industry, you know more about PFAS than perhaps the average individual. So talk to me about how big of an issue that is here in Minnesota and what's being done at the state level to address it.
PFAS is throughout our state. I live in Afton, and my own well is contaminated with PFAS. So we have the big GAC filters in our basement that were provided through funds from the 3M settlement. And so we're fortunate in that regard, but I mean, we've been dealing with it and living with it for so long in my community that I've become acutely aware of the problem throughout the state. And as the EPA continues to lower the thresholds of acceptable levels, we're going to see more issues popping up throughout the state, which is what has happened in Hastings. All 9 of their municipal wells have levels of PFAS that are now above the acceptable thresholds, and they have nitrates too from farm runoff and that kind of thing. So we really do need to ensure that we get the adequate funds to address water quality issues throughout the state, and it's a really expensive problem to fix. So I don't have all the answers right now, but I know there's a lot of us that recognize the need and really want to do what we can to dig in and find the funding necessary to support these infrastructure projects so that the communities themselves don't have to bear the cost.
You've authored a bipartisan bill which modifies the state's Earned Sick and Safe Time law that was just passed off the floor. So talk me through what the bill modifies and why those changes were brought about.
So I think once we enact a bill, it's our duty as legislators to recognize when improvements can be made. And what the modifications to Earned Sick and Safe Time did is address some of the concerns we heard from the business community with regard to misuse. Unfortunately, there have been some folks that have misused the program, calling in sick when they're not sick, and the employers really have very little recourse to address those misuse issues. So what the bill did is it gave employers a little more room to request documentation to substantiate calls when an employee calls off claiming sick or safe time. And if they don't go to the doctor, that's okay. I don't go to the doctor if I have the flu or a bad cold and I just don't want to come in, but the employee can attest. There's a few safeguards. So it shortens the time frame from 3 days to 2 days of consecutive absences when an employer can request reasonable documentation. They don't have to, they can. It also caps the more generous PTO from an unlimited bank to 160 hours, which is what the state of the law was before we enacted Earned Sick and Safe. So it puts everybody back in the position they were before we even enacted Earned Sick and Safe when it comes to protected time. And it provides an exemption to small family farms of 5 or fewer employees who work 28 days or less in a year, and very, very small businesses are micro businesses of businesses that have 3 or fewer employees, to offer some relief to the business community out there in Minnesota. So I want them to know that I heard them, I took their concerns to heart, and I'm really proud of the work that we did with my Senate File 2300 to improve earned sick and safe time in Minnesota.
Yeah, on the floor you said it was a true bipartisan effort, and something Senator Hochschild said during that session was that it's still, even with these modifications, Minnesota still has the most progressive policy in the country when it comes to this. So that was an interesting perspective to hear.
Yeah, I think Senator Hochschild really dug into that a little bit to try to get those numbers, and I appreciate him adding some context on the floor with regard to just what it is that we were trying to do. And with regard to the micro business exemption, by my math, we're talking about 1% of the employee population in the state of Minnesota. You know, I think we have to be able to balance the needs of our workers and the needs of our employers, because if we have employers that are going out of business or not starting a business in the first place, that affects jobs as well.
Senator, final question. What is the legislation or action you've taken this session that you're most proud of?
I think what I'm most proud of is being able to be a voice for some moderate common sense changes. I was just speaking to a member of the other body today about how much courage that takes to stand up and not necessarily push back against my party, but offer a different perspective to the work that's been done in the past couple of years. So I'm really proud of that, and I'm proud that I can stand up and represent my district as a district. And not one party or the other. That's a promise that I made to my constituents, and that's a promise I'm going to continue to honor.
Well, if anybody knows about courage, it's the volunteer firefighters like you. So, Senator, thank you so much for being here.
Thanks so much.